Hello, Dr. Molly Hart here with Pelvic Balance Physical Therapy. I want to review something today that is within the lines of what we call pain neuroscience education. If you've never heard of that term before and you're dealing with pain, then this is something that is, hey, Becca, thanks for joining. We went over this concept today. So, pain neuroscience education or therapeutic neuroscience education is something that, as a healthcare provider, if you are treating people with chronic pain, you absolutely must understand and live and breathe and know this information. Adrian Lowe, Lamar Mosley, David Butler, these are some of the big wig neuroscientist researchers who understand chronic pain and how we're supposed to be treating it. One thing that you'll find surprising is unfortunately that I just graduated 2 years ago, and 2 years ago, I still was being taught very outdated information. A lot of us are taught very outdated information in the healthcare field when it comes to treating chronic pain. So we think about it more in an acute way, meaning like, let's say I just hurt myself. We do not treat chronic pain in that way, and if you do, you will never get better, which is why we have a massive chronic pain epidemic and a massive opioid epidemic, because us healthcare providers are absolutely sucking at understanding this and treating it and educating our patients about it. But today I want to go over a concept with you that might seem super basic, but it is literally the most important thing ever when it comes to healing from chronic pain. So I want to use my whiteboard here to draw out some things. If you guys have questions as I'm going over it, since we're doing a live right now, then shoot me a message. I can see all of your guys' information on there. So one thing that happens with people in chronic pain is they're constantly being flared up and they don't understand what it is that's flaring them. They'll maybe start to feel better one day and then they start to have more pain another day. So if you're one of those people who's constantly flaring your pain, I don't care where your pain is, by the way. This can be in the pelvic floor. This can be in the low back SI joint region. It can be in the shoulder. It can be in the neck. It doesn't matter where the pain is. Pain, actually, believe it or not, is pretty simple to understand throughout the whole body. We have very similar patterns that will occur. So if you're in chronic pain and you cause a flare-up to occur where you're now in excruciating pain the next day, why is this happening? I'm going to try to help you guys understand that. I'm also going to try to help you understand when you're starting to feel better. So let's pretend you wake up and you have a wonderful, beautiful day and things are going really well. You get this sense of euphoria that starts to occur. Hey there, thanks for waving in, you guys. You get this sense of euphoria that, oh my God, I finally feel better right now. And then what do? You haven't maybe done a bunch of stuff in the past days because you've been in a lot of pain. So on that day you wake up and feel better, you go and do all of this activity. And maybe you clean the whole house or you go grocery shopping, you get all this stuff done just to then actually cause a flare-up the next day. So in the moment, we don't have pain. In the moment, I can torture my body, is what I call it. You're not torturing it because you're out living life, but I can go out and live life and do all these things and I'll feel fine. But the next day, you're going to be guaranteed to have a flare-up. And now you're out of commission essentially for another 3 days at least, where you're not going to be able to physically do a ton because you just flared up your pain. So let's look at this on a chart perspective. So if this is my tissues, I'm going to draw a line here. This is my tissues declining in function, okay? So we're going down. So this is a sad, sad thing. We don't want that. Up here, having good tissue tolerance, that's a crappy smiley face that I'm going to draw right there. So anyways, my tissues are declining in function right here. What do I mean by tissue? When I say tissue, I literally mean every single tissue in the body. That's bone, that's muscle, that's ligaments, tendons, arteries, nerves, everything, skin, okay? So tissue means all of those different things. Now, my tissues are declining in here. What can cause our tissues to decline in their ability to perform and allow us to live everyday life? There's one behavioral pattern that a lot of my patients unfortunately get in, and most chronic pain patients get in, which is what we call over and under doing. So what they do is they start to feel better one day, or this is maybe even before they're hurt. This might have led to their injury. So maybe we go and we do a boot camp class or a CrossFit class, or if I'm in chronic pain already, maybe I just go on a simple walk, okay? So I go way past my tissue tolerance. So here's what my tissues can tolerate and handle and be okay. This is me going way up. So proactive physical therapist and request to be in your video right now. Let me get to this point, and then maybe we can talk afterwards about you being in the video. Anyways, so I go way past my tissue tolerance threshold right here, and in the moment, I'm not going to feel it. In the moment, I'm going to feel okay. I don't necessarily notice this. I go above it, then what's gonna happen is the next day, I'm gonna wake up, and it's always a day or two later that you feel this. It's never the day of, typically. I'm gonna then have what we call, so this is a boom, and I'm realizing my handwriting's gonna be backwards on here. This is a bust right here, so this is not good. I then go down. What that leads to is a flare-up. A flare-up, typically, if you're not too bad off, is gonna be at least 3 days. That's very common. I don't care, again, where your pain is. A flare-up on average is around 3 days. So now, for those 3 days, I'm not doing a lot. Now I'm gonna be pretty inactive because I'm in pain, I'm not gonna do it, I'm afraid of movement. So now I'm emotional, I'm not sleeping well, I probably emotionally might even eat some really bad foods for myself, doing all these bad things that are gonna make my nervous system even more flared up and pissed off at me. So this is my boom, here's my bust. Let's say it lasts 3 days, it could last longer if you did a really, really bad boom. Now I start to feel better. It's been 3 days, I wake up, I start to feel a little bit better, I get that sense of euphoria. I haven't done crap for the last 3 days because I've been in pain, so now I'm gonna do a bunch of shit that I shouldn't be doing, but I'm gonna do it because I've been inactive the last 3 days. And I overdo what my tissues can handle, and then the next day, boom, we have a flare up again. So we go in this up and down pattern, and sometimes people can go in this pattern for years. Sometimes it happens, can't understand what you are talking about. Same problems in loading, some problems in loading the video. I'm sorry about that, proactive physical therapy. I will be uploading this video afterwards. So if it doesn't have a good connection, we'll upload it then. Anyways, this up and down pattern, no matter how long it's been going on for, this is going to lead 100% to total tissue destruction. You will never get out of chronic pain. Never. Like, I'm gonna be very frank with you. You keep living your life in this way, and you've actually been able to get out of chronic pain, contact me. I'd love to hear this story because I've never met somebody who's been able to. Okay, so this is one pattern that gets us in a crap ton of trouble when we're dealing with chronic pain, is this up and down pattern. So when we have days of high activity and days of low activity, and we're not in this moderate baseline every day, that's a problem for our body when it comes to rehabbing and recovering from injury. I'm gonna erase this. Okay, what's another thing that massively gets us in trouble? So if I redraw this again, here's my tissue tolerance declining. Another thing is called fear avoidance. Okay, so if I'm fearful of movement, and I now think movement is so bad, I should never move, I should never go walking, I should never exercise, I should never go up and down stairs, and I just start to avoid movement altogether. What that leads to is I never even reach my tissue tolerance. So now I'm just avoiding. Next thing you know, I can't even go up and down stairs without causing significant pain. So when we start to, hey guys, I'm gonna wave at all of you. When we start to avoid activities, some people have like abdominal pain, for instance, and then they just won't touch their belly ever or ever put pressure on it. If you avoid areas of your body that have pain and you like overprotect, you are doing yourself a massive disservice. You are gonna create way more pain, way more sensitivity in that region. If there's an activity that really should be safe, such as going up and down stairs, and you're avoiding doing that because you're afraid of what it might cause, you are doing yourself a massive disservice. You're just gonna make your body weaker and weaker and weaker. So what do we do? How do we rehab? So how do we get our tissues to start to actually incline and actually progress and go through a proper rehab program? We have to do what we call the staircase method. So we find out where our tissue tolerance is at. That's something I specifically help patients to understand because they have a lot of times there's a huge lack of awareness of where their tissue tolerance is. Some people are like, it's just a 10-minute walk, I should be able to do that. Yeah, maybe, but maybe not. Maybe you can't do a 10-minute walk right now. Maybe your body is so deconditioned, you can only do a 5-minute walk before we're gonna flare. So coming into a session and getting an evaluation by a therapist who understands pain neuroscience education is really important because then the therapist can help you guide this program. So I find out what your baseline is and what your tissues can tolerate. We find that activity level, we hit that activity level, and we stay there for a week. The next week, we go up by 10%. It's called the 10% rule. I increase that activity by 10%. So let's give an example. If you can go on a 20-minute walk, and that's your baseline, beautiful. Next week, 10% of that, 2 minutes. Now I can bump up your walk to a 22-minute walk. And you can do this potentially every day. Maybe you can't. That's something you again have to figure out with the therapist and how your body's responding. And this is just with activity. There's a whole host of other things that are involved in this, but we're just gonna stick with activity. So I find my baseline, I go up by 10% the next week, and every week I slowly increase my activity. For that week though, I'm trying to stay at about a moderate level of activity every single day. So every day I'm doing small doses of activity versus one day of a ton, one day of nothing. Because if I do a ton of activity 2 days a week and then nothing the other days of the week, you're just screwing your body. You are literally making it impossible for your body to heal. Think about this analogy. If I'm training for a marathon, which I probably won't ever do because I hate running, but if I was to train for a marathon, I'm not gonna go out there and just run 10 miles. If I go run 10 miles, by the way, I could probably do it right now. I would hate it, but I could probably do it. But I'll tell you what, when I wake up tomorrow, I'm gonna be so freaking sore that I'm not gonna be able to work out for the rest of the week probably, because I don't run typically. So if I'm gonna train for a marathon, what do? You have a whole training program, right? So I will go probably run for a mile every day for the first week. The next week, maybe I'll go to 2 miles and 3 miles. Now, if I don't pace it, like a lot of people don't do properly, then I'm gonna end up hurt and I'm gonna get shin splints and my Achilles tendon's gonna hurt and all these injuries that us physical therapists always treat because people overperform too much. The types of patients that we always treat are people who overdo and people who underdo. Now, when you stay in that nice happy medium, we very rarely have pain problems that occur in chronic pain that occurs. So life, whether it is training for a marathon or training just to do everyday life, we have to do a pacing program, and it has to be very strategic and has to be very methodical, because if it's all over the place and not organized, your likelihood of recovering from chronic pain is very, very low. After a surgery, you have a very specific protocol that you typically will follow when you come to see a physical therapist, or the physician will give it to you. In my opinion, majority of the reason why surgeries work is because you're following a very specific protocol. They have done clinical studies where they've done fake surgeries, where somebody gets an incision, they think they got a surgery, and compare them to people who actually got the surgery, the true surgery, and then they go through rehab together, and both of them have the same positive outcomes. Why? Because if you think you had surgery, you're gonna slow down and give your body the grace it needs to slowly rehab it appropriately, versus abusing it one day and then totally resting the next 3 days, abusing, resting. So if we constantly go in this up and down pattern, I hate to be the bearer of bad news, but you're gonna really, really struggle ever recovering and healing that human body of ours. So if this is something that's happening to you and you're in this state, please feel free to reach out to me. I do telehealth online, and I treat a lot of people all over the country, or find a PT in your area who's very well versed on chronic pain. And if they know what pain neuroscience education is, therapeutic neuroscience education, if they know that lingo, then you know that you're in the right hands. If they don't know what that is and they don't understand that training and have looked at that research, then hopefully they know what they're doing, is what I would say. And they really should hopefully go and check out the new research on chronic pain and how we're supposed to be treating that as healthcare providers. So thank you guys. I just wanted to come on here and share this message. And if you guys have any questions, you all let me know. Okay? Bye. Enjoy the rest of your Friday.